Good day, everyone. My name is Frances Nozier, and I'm a student registered nurse anesthetist at Florida International University. The topic I'll be presenting today is acupressure to decrease post-op nausea and vomiting compared to ondansetron in patient undergoing laparoscopic procedure. This quality improvement project will first discuss the prevalence of PONV in postoperative patients. It will identify risk factor of PONV like the population and the surgery types. It will also discuss consequences of PONV when left untreated. Also discuss what is lacking in the current treatment. And it will also demonstrate knowledge of Neguen point, the P6 acupuncture and its benefits for PONV. Post-op nausea and vomiting affects over 80% of high-risk patients and 30% of all surgical patients. Even though laparoscopic surgery have a quick recovery time, it is associated with a high percentage of post-op nausea and vomiting complication. But debilitating side effect of ondansetron call for better treatment. So we come with acupressure. It's based on the traditional Chinese medicine practice of acupuncture. So how does it work? It works on putting pressure on certain places of your body. These places are called acuprint. So pressing this acuprint can help your muscle relax, improve blood flow, and it decreases nausea and vomiting. What are the risk factors of PONV? We have three types of risk factor. Patient, like most pubescent female are 3 times more likely to get PONV. We have patients with history of motion sickness, obesity, diabetes, hypothyroidism, history of PONV, and opioid users and non-smokers are high risk patients of having PONV after surgery. What kind of surgery are you having? Is it abdominal? Is it a cholecystectomy? Is it gynecological? Or is it a laparoscopic surgery? And what kind of anesthesia are you getting? Is it general anesthesia? Because it has a higher risk factor than regional and local anesthetic. Postoperative nausea and vomiting is one of the most common complications after surgery and anesthesia. Although it is not a life-threatening complication, it can cause dehydration, electrolyte imbalance, wound descent, pulmonary aspiration, and delay hospital discharge. The general incidence of vomiting and nausea after surgery and anesthesia is about 30% and 50% respectively. And the PONV rate can be as high as 80% in a subset of high-risk patients. It is reported that PONV can also result in a significant increase in overall healthcare costs. Despite the widespread use of antiemetic drugs, the management of PONV is unsatisfied, and PONV still affects about 20 to 40% of surgical patients after the use of anesthesia drug. Meanwhile, antiemetic drug can also cause some side effects like sedation, headache, constipation, and fatigue. Therefore, anesthetists and CRNAs like me to be try to find some inexpensive and non-invasive method to treat PONV like acupressure. Now, let's talk about the shortcomings of ondansetron that most people know as Zofran. Ondansetron is an antiemetic and first line of treatment for nausea and vomiting. It's a 5-hydroxytryptamine, 5-HT antagonist serotonin receptor. What it does, it regulates motility and relays information in the gastrointestinal tract, but it can cause some unwanted side effects such as drowsiness, headache, fatigue, increased sedation, and constipation in the postoperative patient. Acupressure is a non-invasive therapeutic method applying physical pressure to certain acupressure points by finger, elbow, hand, or with various devices. The popularity of acupressure has increased over recent years and has been found to be the fourth preferred complementary and alternative therapy in hospitalized patients, especially in Australia. Pericardium P6 acupressure point called Neguen point and found on the inner arm close to the wrist. Traditional holistic Eastern medicine treatment utilized as nausea, vomiting, and pain treatment. But do not use acupressure on this point if the skin at or near the point is peeling or blistering, there is an open wound or at near the point, there is a rash or at near the point, or there is redness, swelling, warmth, or pus at or near the point. How does the P6 acupressure point works? It's a pressure that's put on P6 point near the inner wrist in the surgical setting. It would be done with a needle or wristband. Transcutaneous acupoint electrical stimulation, that using a needle that transfer electrical stimulation to the P6 point. Have intradermal thumb back needle inserted in the P6 point bilaterally and manually stimulated on demand. The P6 acupoint lies between the tendons of the palmaris longus and flexor carpi radialis muscle. It is like 4 centimeters proximal to the wrist crease. Different studies have shown that stimulating P6 acupoint may affect the endocrine system of the body. It regulates the level of beta endorphin in cerebrospinal fluid and the transmission of endogenous opioid and of 5-hydroxytryptamine in serum. It inhibits the secretion of gastric acid. It regulates gastrointestinal function and thus stop nausea and vomiting. So acupressure point on the P6 side in order to relaxes the muscle and improve blood flow. It increases the release of endorphins and facilitating a feel-good sensation. It decreases the release of serotonin, thus reducing the effect of the transmitting associated with PONV. Also increases gastric movement or peristalsis, thus reducing incidences of nausea and vomiting. The application of acupressure to the P6 point using wristband for a cumulative of at least 30 minutes was shown to significantly decrease the severity of nausea and vomiting more than regularly administered antiemetic. Acupressure was also found to significantly reduce the need for antiemetic medication while increasing the rate of urine ketone clearance. Overall, the adherence to the usage of acupressure wristband was perfect with no dropout. And also, acupressure increased patient satisfaction due to its effectiveness of treatment and no significant side effects. Also decreases the need for Odin syndrome. The implication of our studies was the existence of an effective adjunct to alleviate the severity of nausea and vomiting in patients undergoing laparoscopic surgery, thereby improving their quality of life and improving their satisfaction. So that's for the end of our presentation. Thank you so much for the attention and interest.